Jafia ma'am, you can start now.
Good evening. This program aims at finding solutions to your queries and seeks answers to the common myths and doubts regarding COVID that is hounding you. We will help you out to differentiate truths from myths. I am Mrs. Zafia Solomon, Vice Principal and IKC Coordinator of Annai Violet Arts Science College, your host for today. We have been having a series of topics discussed during the last few days regarding the digitalized system during the lockdown period. We also learned in depth the nature of the coronavirus, the origin and the development of the virus, the economic impact post-COVID for the past few days. A warm welcome to this Med Talk on combating COVID-19. This is a live session with Dr. Grace Mercy Priscilla. Where the enemy is invisible and rapidly advancing, human reactions tend to follow set patterns. In our case, it is COVID versus us. The session is open to questions from viewers. It's a live session with Dr. Grace Mercy Priscilla. You can type your questions in the chat box. The enemy is invisible. The session is open to questions from viewers. You can type your questions in the chat box so that we can take up the questions for further discussion. Before going on to the video at the outset, I would like to take this opportunity to salute and congratulate our health workers, especially the nurses, the angels in white. The angels in white for the tireless, unstinted support and human service during this time of the pandemic. Yesterday, the 12th of May, being the International Nurse Day, day in and day out, they have been risking their lives to save us. We are all indebted to them always, and many have sacrificed their lives. We remember them too at this moment. As health workers and the frontline workers who are tirelessly working and sacrificing their time and energy for us, we should respect them and also pay tribute to them when they are not with us. Hope we can remember this in our lifetime. Over to Mr. Yuvanesh for the video.
3 weeks, all of India and its 1.3 billion people will be subject to a complete nationwide lockdown. The announcement was made by Prime Minister Narendra Modi in a televised address to the nation. Prime Minister Modi has said that every Indian must stay indoors, even if they're not sick and not displaying symptoms of COVID-19.
From midnight, there will be a complete lockdown in the whole country. There will be a total ban on venturing out of houses from midnight. To save India, to save every citizen of India, to save you and your family.
He's urged all Indians to forget what it's like to go outside for the next 21 days. He said the extreme measures were necessary because India must avoid what's happening in Italy and the United States right now, where cases have been increasing exponentially on a daily basis. He reminded Indians that developed nations with stronger healthcare facilities have been unable to stop the virus's spread, which is why it's imperative that India not wait for a mass breakout before implementing stricter measures. The Prime Minister's speech triggered panic buying in most parts of India. He later had to tweet to clarify that all essential services like pharmacies, hospitals, grocery stores will continue to operate. The government, though, is urging businesses to deliver essentials to the doorstep of citizens to limit the movement of people. The Indian government has also responded to criticism that India's healthcare system with low funding and stretched resources needs to be augmented. Prime Minister Modi said his government will be spending nearly $2 billion in the coming weeks on buying testing kits, hazmat suits, ventilators and training medical staff. India has some of the lowest testing rates in the world, but the government says mass testing is not needed right now because it will only lead to more panic on the ground. Neha Punia, CGTN, New Delhi.
We're putting out this morning the latest numbers from the Health Ministry on the coronavirus outbreak in India. The overall cases now has crossed the 70,000 mark. 70,756 cases of COVID-19 have been reported in the country. Essentially, this is a jump of 3,604 cases from yesterday. Now, out of the 70,756 cases, 46,008 cases are active COVID cases. Now, the death toll stands at 2,293, which is an increase of 67 fatalities in the last 24 hours. The worst hit states are Maharashtra, where the number of cases has risen to 23,401, with 868 deaths in the state, a majority of those in the city of Mumbai. Over to Gujarat, which has 8,541 cases and 513 deaths. The third worst affected state now is Tamil Nadu, with 8,002 cases and 53 deaths.
We were taught to think positive and leave all negativity, but in the present situation, we are happy not to be negative from COVID-19. The video clearly illustrates the current circumstance. We are all aware of the fast spread of the novel coronavirus and the impact it has made on every individual. We have with us Dr. Grace Mercy Priscilla, MBBS, MD, DMRT, Assistant Professor, Department of Radiation Oncology, Madras Medical College at Rajiv Gandhi Government Hospital. Dr. Grace has completed a schooling from EWAT in 2002, joined MBBS Government KAPV Medical College Trichy and the Tamil Nadu MGR Medical University and graduated in the year 2007. Did her internship at Madras Medical College. She pursued a postgraduate diploma in medical radiation oncology in the year 2009 to 2011. Dr. Grace has presented papers in state and national conferences. She has also given medical talks at the Madras Medical College and at Meenakshi Medical College and University. She joined the government service in 2011, Regional Cancer Center of Tamil Nadu, Arinyar Anna Memorial Cancer Hospital and Research Institute at Kanjipuram till 2015. From 2015 to 2017, she pursued her MD in Radiation Oncology at Cancer Institute, Adyar, graduated as the best student with gold medal. In 2019, she joined Madras Medical College. She is also practicing at Bilroth Hospitals and at VS Chetpat. Dr. Grace has got a passion for teaching. She is a table tennis player and passed the Trinity College of Music London piano exams with distinction. She also loves traveling and driving. We welcome you, Dr. Grace, for today's Med Talk.
Thank you, ma'am.
She is a medical person working at present, and we think she is the right person to give us a view of what the present situation is at Tamil Nadu or the Chennai and the overall pan-India for us to a vivid explanation about the COVID situation. Now, viewers, this is not a usual seminar or a webinar where we will be speaking. It is now open to all to give your questions, and the doctor is willing to answer your questions. There are a lot of myths and doubts that are arising amongst the laymen, which we need to clear it, otherwise we will get into trouble. Now, as the world wrestles with the unprecedented implications of coronavirus pandemic, people have realized the value of life. Medicine is a science of uncertainty and an art of probability, says William Osler. At present, during the time of uncertainty, to highlight the probabilities of facing the present scenario, The purpose of a doctor or any human in general should not be simply to delay the death of the patient, but to increase the person's quality of life. Let's hope this session will enable us to improve our quality of living and make us strong to face such situations at present and in future. Viewers are welcome to send your questions through the chat box. Dr. Grace will answer your queries. I request the viewers to like the streaming and also subscribe and click the bell icon for further notifications. I hand over the session to Dr. Grace with a question to begin with. Dr. Grace, what is COVID-19 and how does it spread?
Yeah. So, very good evening to one and all gathered here. I thank God for this opportunity. And at the very outset, I would like to thank Dr. Kamala ma'am, who is the principal of Annai Violet Arts and Science College, and my dear friend, Mrs. Zafia, vice principal, for arranging this wonderful forum to interact with all of you here. So, a big hi to everyone, okay? And I have done away with PPTs, which have become a part and parcel of our daily routine, especially during this lockdown period of webinars, and have come up with some personalized ideas of writing in a chart. Because like we're all going back to, the 90s and the early 2000 area where we have been using all these materials, and when we didn't have these PPTs. So I have around 5 sheets with me regarding COVID-19, and I will try to explain it in as simple way as possible, and I hope you will both find it interesting and useful. I'll be talking a little bit on each sheet. So I know most of you are here for your certificates, but I just hope that you will make the best use of this webinar and try to ask whatever you have in your mind. And this situation is actually baffling to the medical field, medical profession also. So let me try my best to clarify your doubts. Fine. So going on to the first question. Mrs. Zafia, she asked me, what is COVID-19? Can you see this? Ma'am, can you see it?
Yes.
Yeah. So I've done this in black. You know why? Yeah, it's because this COVID-19 has caused a lot of, despair, gloom, and to separate a lot of loved ones, and so much of unexpected deaths all around this world. I've put a sad smiley here, okay? So that is about this present situation in a nutshell. Now, this C and O stands for corona. You all know about this. And this V and I will stand for virus. D stands for disease. And this 19 stands for 2019, the year in which the first case was reported in the city of Wuhan, China. But this disease was classified as a pandemic by the WHO, or the World Health Organization, on the 11th of March, 2020. Now, I just want to, talk a little bit on how this virus looks. See, we all like to look good. See, we know we all like to describe ourselves like beautiful, smart, handsome, and all that. But how does this virus look? Now, this virus belongs to what is known as a coronavirus group of coronavirus family of viruses. And there are around 4 major types. That is the alpha, the beta, the gamma, and the delta. We have 4 types. And out of that, the beta is the most important, which has around 5 subtypes. And one of them is affecting and causing the pandemic all over this world. The virus which is causing the pandemic right now is termed as SARS-CoV-2, because it has got a combination of characteristics between the virus which affects the bats and the human coronavirus. So it is it has a similarity between both the viruses. And so right now, there are around scientists have identified around 7 strains of this human coronavirus. And it is mutating at a rapid rate. We have no idea about like how much is going to mutate further. And being science students will be aware of what is a nucleotide and amino acids, and little bit about that. This COVID-19 has around 30,000 nucleotides. Okay, and these 30,000 nucleotides will account for, or it will encode, or it will produce around 10,000 amino acids, and the group of these 10,000 amino acids will form one coronavirus. And this virus looks, like it's a spear shaped. It has spikes all over, just like a crown. I know all this is like, it's going around in the news. You people will be aware of it. I just want to highlight, and it's very tiny. It's around, the diameter is around 60 to 140 nanometers. So there was a presentation initially which showed the statistics, and I would like to concise the statistics worldwide and in India and in Tamil Nadu. So the total cases worldwide has crossed around 43.5 lakhs. But the number of cases which have recovered around 16 lakhs, and the death rate is, the number of cases who have died is around 3 lakhs. So you can see 16 lakhs recovered, 3 lakhs have died. In India, coming to India as a whole, you saw in the video, the cases have crossed 70,000. Okay, but the number of cases, number of people who have come out from this deadly disease has crossed 23,000. That's a huge number. Okay, and the ones who have died, the number of people who have died is around 2,300. Coming down to Tamil Nadu, we have crossed 7,000 cases totally, and we have recovered around 2,000 cases, and the number of people who have died is around 50. So you can see the number of cases who have died is very less compared to those who have recovered. But why is there so much of hype about this coronavirus when there's so little of people dying? It's because of the rate at which it is spreading. Okay, and it is a highly virulent virus which keeps spreading rapidly, and so that is the reason why we are trying to contain the spread of this virus. Okay, now this number of people who have died could also be having a lot of underlying diseases in their body, like diabetes, hypertension, which is like dominating the entire population in India and also in other parts of the world. So the present fatality rate, which has been given as of today, is 3.2%. What do you mean by fatality rate? That is the percentage of people who have been affected and who have died. That is only 3.2%. But the recovery rate, the persons who have recovered, that percentage is 31.74%. So that's a big thumbs up sign for us. So we need to not give up our hope, be positive, think positive. We can fight this virus. We will be able to recover. And another bit of good news is that the doubling time, that is, see, for example, there are 100 cases. For it to become 200 cases, earlier, it was around 10.9 days. That was the duration within which the number doubled. But now it has slowed down to 12.2 days. That is another bit of good news which has come in today. So you people can log into the WHO board website or the John Hopkins Center for Infectious Diseases website. All these websites will give you better information on this COVID-19 statistics going on in this world. Now, I want to tell you about I'm going on to my next paper. Okay, all of you are, I hope all of you are listening, and I hope it's interesting. So a little bit more about how this coronavirus acts. What is the mechanism by which it enters our body? What and all it does inside our body? How does it spread from us to another person? So all these will be dealt with in this sheet of paper. So the action, see, I've written it in green color. So it's we are ready to find out how it's going to act in our body. Okay, So how does it enter our body? It can enter through the eyes, the nose, the mouth, or the ears. Okay, so that's why the government has said avoid touching your eyes, nose, and your mouth. Okay, so I know you'll be hearing all this repeatedly when you dial up someone for the past 2-3 months. It's very familiar, but I still want to stress, because it is absolutely essential that you refrain from touching your eyes, mouth, and your nose. Remember it as there was a latest meme which has come up in the internet, which says refrain from men. M for mouth, E for eyes, and N for nose. Okay, so remember that. And what happens once it enters our body? It increases our immune reaction. The immune system, that is the power to fight any foreign body which is entering, any foreign substance which enters our body, like a virus or a bacteria, whatever it is, the power which God has given us to fight these pathogens is known as what comprises the immune system. For those who do not understand a little bit about science, I'm trying to explain each word. So what is this immune system? This immune system will go and eat whatever bad things come into our body, like whatever, it may be a virus or a bacteria or a foreign body, whatever it is, and it will try to eliminate that particular harmful substance from our body. So now this virus will incite, or it will instigate, it will trigger the immune system, and there will be a massive immune reaction. Okay, that is known as medical terms, what is called as cytokine storm. There is what is called as cytokine storm. So there is a substance which is called as interleukin-6, which will increase in our body, and this interleukin-6 goes on to activate the B cells. B cells is what is comprises about the B lymphocytes, or the W. It's a part of the white blood cells in our body. So these B cells are triggered, and these B cells will go and damage the capillaries. What is a capillary? It's the smallest blood vessel in our body. So it's going to damage the capillaries, and these capillaries are like, it reaches up to even the tip of your fingers. So like that, the capillaries are scattered all over your body, and these capillaries are damaged. So what happens is there is a lot of confusion going on in the entire body. Okay, and the lungs are the first organs to get affected. Okay, so that is the main reason why this disease has caused so much of respiratory complications. And this disease goes and eats up all the lung, and there is a lot of clotting and coagulation and all that going on inside the lungs. Not only the lungs, eventually when this virus is not contained, it spreads to other parts of the body, and it causes a whole body or a multi-organ failure in our body. So that is the end stage. So let's go on. Another bit of thing which we need to know is, which is being postulated in the medical fraternity, is that this virus attacks the beta-1 chain. I think beta-1 chain, for the art students, it might be a little foreign, but let me try to explain. The beta-1 chain is part of the hemoglobin, or the molecule which carries oxygen to different parts of our body. So this beta-1 chain in the hemoglobin molecule is attacked. So what happens is, in detail, if you need to know, the beta-1 chain there is a moiety called as porphyrin inside this structure. So that porphyrin is removed, and now so this heme, the metabolism of this heme and hemoglobin is disturbed. Okay, so once this is disturbed, what happens is the hemoglobin becomes ineffective in transporting oxygen to different parts of our body. That is why there is a difficulty in breathing and all that. So to make it simple, then what happens is the hemoglobin will not be able to transfer oxygen to the cells, or bring back the carbon dioxide, and all these sort of confusion keeps going on. So what happens? There is an increase in the iron load in our blood. Okay, so that also causes a thickening of the blood in our blood vessels, and moreover, there is a lot of there is a disturbance in the hemovascular system in our body, and there is what to say, you can say that there is a complete breakdown of the vascular system, and there is a lot of platelets being damaged here and there, causing a lot of fibrosis, fibrin formation, and there's clot formation, the platelets are reducing, the hemoglobin is being reduced, all these so much of confusion happens in the body, and that's how the COVID-19 will bring about a change inside our body. That is how it causes action. That's the action. Okay, and it takes around the incubation period for this particular virus is around 3 to 7 days, maximum of 2 weeks. That's the quarantine time. Okay, and how does it spread to others? So the most important thing we need to know is that the persons who are in close contact with those affected will be able to get the virus or get the infection from them. So that close contact is to be avoided at all costs. Then this virus also spreads through coughing, sneezing, that is the aerosol spread. That is what is being postulated right now. Okay, so this is how the coronavirus acts. Okay, now so now it has caused changes inside our body which we cannot see. How does it manifest itself outside our body? See, that is known as manifest. How does this coronavirus manifest itself outside the body? After it completes whatever disturbance it is causing inside our body, how does it manifest outside our body? So, we are all aware that it causes fever, that is a rise in our body temperature. It causes tiredness or lethargy, what we call it, feeling of weakness, and you have dry cough, sneezing, difficulty in breathing. Some people also have a loss in smell sensation. Okay, so that is another symptom which is being noticed now. And there are also other non-respiratory symptoms like diarrhea. So all these things constitute, are telltale signs that coronavirus has started its work inside our body. We need to be on the lookout. We need to watch out. But we need not worry if these symptoms might also be due to other diseases also. Like, for example, there are so many causes of fever. There are so many causes for sneezing, for coughing, and for difficulty in breathing. There are so many other causes. So there's no need to panic. So once you think that you have these symptoms, it's better you go and test. And once you test, the procedure, there's a normal protocol which the hospitals follow. So you need not worry about that. So there's no need to panic. What will happen? How will I know? When will I be diagnosed with this? How will I know whether I'm having corona? See, one person sneezes, oh my God, it's corona. Don't get so panicky. So you should be aware that there are other causes for all these symptoms, but coronavirus also, the main symptoms are all these. So we need to be well informed and take action at the right time. Now so now this coronavirus group of diseases are classified into 4 types. Okay, the mild, the moderate, the severe, and the critical. So mild disease constitutes around 81% of the total population of people who are infected with this virus. I repeat, the mild cases are around 81%. Okay, the moderate and the severe constitutes around 14%, 14%, and only 5% constitutes the critically ill people. Okay, so now this critically ill, again, they can be classified as mild critical, moderate critical, and severe critical. Okay, so there are so many stages the disease progresses. Okay, and finally, this disease causes what is known as acute respiratory distress syndrome. It causes ARDS. That's called as ARDS. It's acute respiratory distress syndrome. Fine. Now, this acute respiratory distress syndrome will cause so many other things, which in turn will cause respiratory failure, then goes on to multi-organ damage, septic shock, all these things, and finally that will go on to the death of the person. So there is so much of, from the starting point to the end point, that is from the time the virus enters the body till the time of death. There are so many stages, and you need not worry, because when we diagnose a disease early, we'll be able to recover nearly more than 80% of the people can be recovered. So that is another bit of good news we have. Fine. So how do you come to the diagnosis? Okay, diagnosis. What is the meaning of diagnosis? See, the Tamil Nadu government and the Indian government, as well as the governments all over the world, they have come up with they are following the WHO protocol, or the World Health Organization protocol. And our Tamil Nadu government has planned so meticulously, and the place where I'm working, the Rajiv Gandhi Government General Hospital, the protocol is being followed so strictly. And when you go and you present yourself to the outpatient department and you ask yourself to be tested, there is a form. Okay, there's a form to be filled where they'll ask your details, the place where you reside, and all that. Once you're done with that, it goes to the ICMR. Okay, that is the center for the whole of India. And now then this patient is taken to another sterile area where there is a that is a probe, that is what is called as it will resemble a stick with a bit of cotton wrapped around the tip. So you'll be seeing all these things you would have seen on TV, you would have seen on videos, but it's my duty to explain it right now, so kindly bear with me. And this swab, yeah, this swab is inserted into your nose, both your nostrils, and it goes right up, and they take a specimen or a sample, and then another swab for the throat, that is the place where these viruses reside. So once these swabs are taken, it is then sealed inside test tubes. So it is labeled and it is sent to the central laboratory. And what happens, the procedure which they follow is known as RT-PCR. That is a technique which is used in diagnosing or this disease. So what is RT-PCR? It is reverse transcriptase polymerase chain reaction. So this technique, what does it do basically? There's a very little specimen taken from our nose and from our throat. So that specimen is doubled, or it is increased, amplified. The right word is amplified. It is amplified, and so it will be easier for the person who is viewing it under the microscope to to come to a diagnosis whether the person is infected with this coronavirus. So that is how this coronavirus is being diagnosed right now. And we also have a set of different sets of kits which are being available. So the rapidity with which the results are coming out is increasing day by day. The result will be out in around, say, it ranges from around 1 to 3 days. That's how quickly you can get your result and you can start with your treatment. Okay, so I want to talk about another thing which is called as prevention. I have ticked it. Okay, so this is our weapon, our only weapon to fight this invisible enemy right now. Okay, so how do we prevent ourselves from getting this coronavirus infection? One thing is we need to follow all the rules which is being laid down by the government of India. Okay, so you would have heard all these things, but I just want to repeat it again. So you stay home, you stay safe. Okay, but you might ask and when you have a necessity, or if it is absolutely essential for you to go out, then you go out with all the necessary precautions. So that is the first point for preventing coronavirus infecting you. Okay, the next is social distancing. All these have become, the words right now. And social distancing means you stay at least 3 feet or 1 meter away from another person, whoever it may be, and that will prevent you from being infected with the aerosols of this coronavirus. Okay, that is the second point. Then you wear a mask. Okay, there are so many different types of colorful masks available in the market. There is the basic aim is like the infected person should not spread it to others, and the healthy person should not receive it from the others. So that is the aim of wearing a mask. But the healthcare workers, we need what is called as N95 or FFP3 masks. Okay, so this mask will give us better security and protection when we go near a person who's having, we need to ventilate and all that. Okay, that's the third point. So I've told you to stay home, social distancing, and about mask. Now the fourth point, wash with soap and water. Wash with soap and water. I will repeat it. Keep washing your hands with soap and water. Why am I stressing this? It is very important. It is very easy. You can see, you can, if you are you can go to the YouTube and you can see the number of steps, like around 7 steps. So you wash your palms, you wash your fingers, you wash the back of your hands, you wash the middle of your fingers, then your nails, your thumb separately, and then your wrist. All these things, it should last around 20 seconds. So you keep repeating this several times a day, and whenever you touch whatever you feel is infected. Okay, so soap and water washing is very important. It is very helpful in the prevention of coronavirus. Okay, keep washing your doors and handles where you touch often. All these things will go a long way in preventing the infection. Okay, and when you go out, when you don't have soap and water, you take your hand sanitizer along with you. Wash it, use it, and before you drink water, or whether before you have anything to eat and all that. Okay, so dwelling on sanitizers, what are the different chemicals which will prevent or it will kill coronavirus? You have 75% ether, ethanol, chlorine, peroxyacid acid, chloroform. But one thing which will not kill is what is called as chlorhexidine, which is being commonly used. And another thing, when you cough or when you sneeze, how do you do it? You don't cover your nose like this. You cover it with your elbow. Okay, that is to be noted. Then you avoid unnecessary travel, unnecessary gathering, get together. I know it's very difficult to stay at home. It's very difficult. I can understand. I can correlate with you people, but that's going to be the rule of the day for, I think, the next couple of years. So we need to try to entertain ourselves at home, and so refrain from going out. Okay, and once you go outside, there is no other option. You need to go out. So once you go out, and when you come back, there are so many sets of rules to be followed. There are a lot of things which is going on around, but a few steps which I would like to stress upon, which I practice daily when I come back from the hospital. I would like to share it with you now. Okay, so you leave your slippers outside. Leave all your, take what is necessary, like your mobile phone or your car key or pen, wrap it in a plastic paper and plastic cover. Then when you come home, ask someone to leave a bucket of water with salt or with the with Dettol or turmeric powder. You wash your feet outside your house, and then you come inside. If there's a back gate, that is more that's better, and for your entry into your house. And once you come inside, you wash your clothes separately, you take a clean bath, you wash your hair, wash your hands, wash your feet, and all that. After you do all that, you try to take, people are advocating what is known as steam inhalation. It's being practiced for a long time, but people say that we get news that it goes a long way in controlling the spread of this infection. Try to get in some steam inhalation for 10 to 15 minutes. Try to gargle your mouth with the warm water, with a little bit of salt. So all these things you do. And when you come home, you keep your groceries separately. You wash all your groceries with salt water or the wet cloth, and you let it out to dry. All these things are little steps which we are doing our best to avoid this coronavirus entering our homes. Okay, so that's how you prevent. Prevention is always better than cure. Okay, so try to prevent. Keep all these things in your mind. Keep going through some presentations or videos which will talk a little bit more about how to prevent coronavirus. And another important thing in prevention is you become more strong by increasing your immunity levels. Okay, so how do you increase yourself? How do you increase your immunity level? Okay, first and foremost, start exercising. Okay, do a little bit of exercise every day in the morning and the evening. Like say 5 to 10 minutes of squats, or jogging on the spot. If you have a treadmill at home, it's even better. So all these exercises will try to keep your immune system in place. And you need to take in a lot of vegetables, like fresh vegetables, fresh fruits. If you are a vegetarian, if you're non-vegetarian, you take an egg and milk every day. You can take greens. They say ginger is very helpful. So these are some of the things which people advocate, scientists and medical people advocate to intake and increase and build up your immune system. And some people are trying out yoga and meditation. All these things also will relax your mind, keep it stress-free, develop a positive attitude towards life. All these things will go a long way. And other than that, you take some supplements. If you feel you can take in some B-complex tablets. You can take government advocates taking zinc tablets and vitamin C tablets, vitamin D. There are so many things which is being postulated, saying that all these vitamins and B-complex will increase your immune system. Okay, so we're just trying. No one is like sure about how this works, but I'm sure shortly the scientists worldwide will be able to come to a definite conclusion. And healthcare workers are being treated with, they are given prophylactic treatment with what is known as hydroxychloroquine. This hydroxychloroquine cannot be taken by everybody because it causes, they say, some people, some papers, some studies say that it might cause cardiovascular damage. So we need to take a baseline ECG, which most of you might know what is ECG. So once you take an ECG, and if it's normal, you get a physician or cardiologist opinion, and then the healthcare workers is given this hydroxychloroquine, and there is a protocol which is being issued by the ICMR, and that protocol is followed for hydroxychloroquine for all the healthcare workers. Okay, so that is about prevention. Okay, now the next paper I have is treatment. Why have I put 3 question marks here? Because no one knows what is exact treatment for this deadly virus yet. Okay, so there's no specific treatment yet. And what do we doctors do? We give what is called as symptomatic treatment. What do you mean by symptomatic treatment? Patient has fever, give him a little bit of antipyretics, that is crocin or paracetamol, give him B-complex, give him, if he sneezes, give him, if he has cough, give him vaporized nebulization. All these things is what is known as symptomatic treatment. That is, treat the patient according as he has symptoms. That is known as symptomatic treatment. You support the patient with adequate amount of fluids, don't allow the patient to dehydrate. All these things will prevent the renal failure and prevent overload in the lungs, fluid overload in the lungs. All these things are being followed very meticulously in our wards, especially at Rajiv Gandhi Government General Hospital. We follow the WHO guidelines, WHO protocol, and there is extreme aseptic precautions which are being taken, and meticulous cleaning and of all the wards, all the patients, and there are the doctors and nurses and healthcare workers round the clock attending to them, and there are so many the ward workers and the sanitary workers who are doing an excellent job, and we need to give big shout out to all of them. And that is about so in general about the treatment. And there are a lot of drugs which are being tried, like but there's no conclusive evidence, like steroids and hydroxychloroquine, and there are drugs which are being tried, like those drugs that are being used to treat the HIV or AIDS patients, like antiretroviral drugs, which because this virus is almost similar to the human immunodeficiency virus, and so all these drugs are being tried, but there is no specific treatment which has been identified yet. And then patients suffering from difficulty in breathing, we give them what is called as nasal oxygen. That is, we keep a mask, oxygen mask on the nose of the patient. Okay, so that is called as non-invasive inhalation. Okay, non-invasive ventilation. That is we don't go inside the body of the patient. We give oxygen from the outside. That is known as non-invasive ventilation. When the patient deteriorates further, then the patient will be intubated. That is, we will send oxygen inside the patient through a tube into his lungs and connect the patient to a machine which is called as ventilator. So that is the what to say about a little bit about the treatment. Okay, so we keep a tab on the blood parameters. We do a repeated blood test, and we try to prevent and treat complications if it arises. So round the clock, 24 hours, doctors and nurses are available in all the wards, all the OPDs, to cater to the population of Tamil Nadu and India. Okay, and finally, when will this end? Is there an end to this particular disease? So this disease will end only when what is called as nearly 80% of the population will develop what is called as herd immunity. Herd immunity. So what is herd immunity? That is when around, say, 5 people are there and 4 people are resistant to the disease. That's known as herd immunity. That is 80% of the people, they are resistant to the disease. Then those who are not immune also will be able to combat this disease effectively. That is known as herd immunity. So that is how to achieve 80% herd immunity. In India, how can we achieve 80% immunity? It's because it's like either the people must get infected or a vaccine must be formed. These are 2 methods by which 80% herd immunity can be achieved. Okay, so that is our goal. But the number of people who are infected should become less, and the rate at which we are going to develop the vaccine must be more. So once we find the vaccine, then it will be easier to control this virus. And there are a lot of trials which are going on in different countries, and also in India. I think phase 2 trials are being. There are different phases in vaccines development, and right now I think there are a number of phase 2 trials which are being going on, testing, and hope and pray that the vaccine for this virus will be found as soon as possible to save us and give us freedom from this deadly disease. So that's about treatment. And any other questions?
Thank you so much, Dr. Grace. We've been hearing a lot about it, and
hope it was useful.
It is useful, and very happy to know that you have given us a spark of hope by telling us the positives that are in the present scenario, where 12%, 12.2% of doubling has slowed down. So
Yeah.
is it because, will you say that it is because of the people who have strictly followed the lockdown, like
Of course.
stay at home and stay safe? Is that
Yes.
the reason?
Yeah. That is the main reason, and people are more aware. This awareness has spread to different villages. Even the nook and corner of the villages, people are aware. They don't allow people to enter their villages. There are restrictions at the entrance of the village, preventing people from the cities entering their village. So all these things are there. People are more aware, and it wasn't like this when the disease started in India.
Yeah, that's true. And there also, along with the other positive messages that we get about the coronavirus, we do get the myths and myths also, which are surrounded by some people who spread certain things that they come to know about. And as such, we have one question where regularly rinsing your nose with saline will help prevent infection. So, is that a myth or a fact?
I think it's a myth, because it's I haven't heard about it, but rinsing your nose with saline water, yeah, it's kind of weird, and
So this
I think
kind
it
of
was,
myths are also spreading among
yeah,
the
so
people.
that
So
inhalation will be a better choice. Steam
better
inhalation is a
choice.
better choice. Yes.
Yes. And there's also another thing that the virus is not new. It already existed.
Of course,
Is that
it existed. There was a spike in its mutation last November, and that is the reason why it has spread from the animals to human beings.
okay? So that is true. It is not a
Yeah.
myth. Okay.
No.
So, and there are also another myth saying that antibiotics will not work against the strain of coronavirus.
Of course, it doesn't work against, it doesn't kill the coronavirus. Antibiotics is basically for reducing the temperature, the body temperature. Okay, so when you have a fever for any reason, you can take an antibiotic. Okay, it is going to reduce your fever, but the fever will recur because this antibiotic has not worked on the virus.
Okay. So now actually there was another question saying that one person had asked in the beginning of your speech, you were telling that there are 7 varieties of this virus, 7 strains of coronavirus. So now is there a particular strain that is prevalent, dominating Chennai or any other place?
We are
Anything
not
like
we
that?
are not very sure about that.
Not okay. So is that the reason why we are not able to get
Yes,
any
vaccine.
vaccines? Okay.
Yes.
So, and also there was another question, like there again a myth or a fact. Vitamin D deficiency causes
Yes.
coronavirus.
Yes. Yeah. I've spoken about this to my orthopedician colleagues, and when this came out initially, so and they weren't very sure actually. Even they weren't very sure. Okay,
So we
because
can't say it is a fact or a myth. It is
yeah,
under research.
yes. So I personally started taking vitamin D, but I don't know whether I can advocate it to everybody.
Okay. And also there are some questions, Doctor, for 1 minute.
Yeah, sure.
Like there is one question, like how long will the virus survive inside a healthy person and immunocompromised person's body? To repeat, how long will the virus survive inside a healthy person and immunocompromised
Of
person's
course.
body?
Yeah, and a healthy person, because the immune system is better, the person will not manifest that much of symptoms. So he could be an asymptomatic person, and we will never know. Even I could have had this disease and I wouldn't have known it. So there is a category of people who don't manifest with symptoms. So these people are healthy people, and those people who manifest, we can't say that they are not healthy, but maybe their immune system is a bit weak. And immunocompromised patients, like persons with tuberculosis, those with malignancies, those with immunocompromised states like those on chemotherapy drugs, and those with the infected with HIV, all these people are more prone to get easily infected with this coronavirus, and to manifest symptoms, more number of symptoms, and more severe, the severity of symptoms will be more in these patients.
Okay. So actually, there was, again, this is that a time where we are all in the lockdown. All of us are stuck to the kitchen as women, and also the Uber Eats and the Swiggies are off now on duty. So now
Yes.
there's a question: does coronavirus spread through food?
Well
Because
cooked
we've
food.
stopped buying outside. It's only homemade food now.
Yeah, that's correct. Homemade food is always better. It is the rule of thumb. You eat homemade food until and unless it is like, it's not possible for you to cook or get the source vegetables or the ingredients. And even if you need to get it from outside, you should dispose of the container in which it comes. And what you do is you put it inside your own vessel, like a kadai or something like that, and you heat it up nicely so that whatever germs, whatever infection it might carry will be destroyed by heat.
Okay. And also in your speech, you were saying that the two ways to prevent the treatment is either you get infected, like when we were kids, they usually used to say that it's better to get chicken pox so that you won't get
Yes,
it in your
yes,
lifetime. So
yes.
is it like that we are?
No,
Because coronavirus is really a hard thing
it
to
doesn't
take
give
it up.
lifelong immunity.
Okay. So now, once the patient is infected, and again after they recover, they are kept under quarantine for another 14 days. But
Yes.
Is there any chances of relapsing after the event? Because in China, we hear that there are
Yes.
now the increase of patients in China also. So
Yes.
so they
Yes,
are
but
prone
the
to
infection
relapse.
can occur.
After the
Even
recovery
after,
also, they can relapse.
yes, there is a chance of relapse.
Okay. And there's another question: why plasma therapy is not successful in treating this viral disease?
That is not my forte as such, but maybe if you can, I'll try to get back with those answers. It was being tried out in Kerala, I think, but I'm not sure why it didn't work out well.
Maybe it's again under research.
Yeah.
The death rate of India is comparatively low when compared to other countries, but people in India are so panicked. Is that what is your view on that?
See, when the death rate will be low, but if more number of people are infected, the number of people who are dying due to this disease is also going to increase. Okay, so that's the reason people are panicking.
Okay. 1 minute. That's what I asked, the strain and also the without symptoms. We get corona means how can we find it before going to hospital? Is it possible that a patient can be positive without having any symptoms
Of course. It's not possible to find out if the patient doesn't manifest.
Yeah, but I think there's another relevant question where it says how to differentiate from a common cold to corona infection.
That's only by testing, lab testing.
So almost the same symptoms are prevalent, and
of course, yeah.
In case the patient is mildly infected, so can they survive without or can they recover without any medication?
Of course, because right now the rules have changed, and we are advising people who are having mild symptoms or no symptoms. That is, those people who are become positive as a contact. So those people also they will not be having any symptoms, and those who are having mild symptoms, all these people are advocated home quarantine. So they need not be treated as such. It will subside on its own.
I don't know, as an allopathy doctor, will you accept this? Can homeomedicines cure coronavirus? Because there's a lot of spread that preventive medicines are available in homeopathy. So
I don't know. I have no right to answer that question.
Is the successive effect about the nasal oxygen given to the affected people will help?
See, it's actually a double-edged sword. So nasal oxygen actually it helps the person recover in that acute phase. But people there are studies which say that nasal oxygen and intubation, putting the patient on ventilator, and all these things will worsen the disease in the longer run.
Actually, there was a or in the beginning of the coronavirus situation, they were said that old people and kids are at high risk, and mostly the diabetic patients are more prone to get into this infection. What is your say about it?
See, the immune system is weak in elderly as well as in diabetic people, because diabetes is another type of immunocompromised state. So that's correct. People who are old and those with underlying comorbid conditions like diabetes, hypertension, all these people are more prone to get this disease, and the severity of the disease will also be more in such cases.
Actually, there's a question about exercise. You've already explained it very clearly to work out morning and evening. There's another question. Salt kills majority of the virus. Will it effectively kill coronavirus?
It is being advocated as an effective killer for this virus, but you never know. No one is sure. Medical fraternity is not very clear about this.
So now this period where we don't know who's affected now. Now we are in the stage where we don't know where it has spread, and we don't know whether we are the person whom we are meeting every day also, whether he is positive or negative, we don't know. But at that situation, how can we prevent ourselves is the bigger question mark. But at the same time, prevention in the case of, as you said, to increase our immunity system. So this time of, there is also a myth saying that poultries, the non-vegetarian eaters are scared of having non-veg because it might be a source of or a carrier of this virus. Is it a myth, or can we go with this non-vegetarian?
See, any food if properly cooked at home and eaten with the necessary you clean it properly, you cook it properly, and you cook it at home and you have it, I don't think it's going to be a source of infection. So non-vegetarians can continue having it, I think.
Okay, and what is the recovery time for coronavirus disease? And the period it takes. We are quarantined for 14 days. That's the incubation time, you call it, as a medical person. But after that, when they are taken into the wards for treatment, you told us the government protocols over there. But how long does it take? Again, is it the same 14 days? Or it depends on the severity of the infection?
Yes, depends on severity, and like we have seen cases being discharged in around 3 days. So that's a good news.
There are a lot of good news that you've given us, so which has made us more. I think it's giving us a boost to face this COVID situation. The recovery rates in Chennai, because today, as of 13th May, I think the death toll has increased pan-India to more than 2,500 or something. But will this increase or will it decrease? We don't know. It is not in our hands. But what is your view about it?
Statistics say that the census will peak in the middle of May, and it is going to. It might decrease by the end of June, early July. But this disease is going to stay in for around 2 years. That's what statisticians and epidemiologists are advocating.
Actually, when a coronavirus patient is infected and we inform the doctor or anybody in the area, we hear that they are taken to the hospital and the family members are not allowed to meet them or see them. Is that the real case, or we are allowed to meet them at least through once or twice to know their status, or will they give us information? That's a big question mark to us, because we are scared. In that situation, even if we are infected, they'll be scared to tell, because they'll be isolated from the family.
Yes.
So how is it?
Yeah, family members are actually not allowed to meet, but that is the main reason, because the thing is, the main aim is to prevent the others from getting infected again. But to reduce the rush and the government hospitals, and to try to maintain what is called as safety precautions in the ward, people are prevented from entering those places. That's the reason why others are not allowed inside. Because even when a single outsider has to go inside, he or she has to wear the entire PPE, or the personal protective equipment, and it's very difficult. Trust me, I've been in the corona ward duties and in the corona OP duties. So wearing a PPE and staying inside for the duty hours, for it ranges from
Yeah,
6 to
I saw that video. A nurse getting herself prepared to go into the isolation ward. Layers of preventive
very
things
difficult.
that she had to wear.
I know.
Yeah, it is.
I've done it personally, and I know how difficult it is. So especially in May in Chennai, when it is very, very hot, it's very difficult to survive with the
Hats
PPE.
off to all the healthcare workers. We
Yeah,
do
and then we are
respect you
not
people.
allowed to. Yeah, we are not allowed to be with our family for nearly 2 weeks. So it's a very pretty difficult situation for all the healthcare workers.
Oh, thank you so much for taking the strain to take care of us as a doctor. There is another question. Preliminary study suggests a mutated coronavirus strain has become dominant worldwide and is therefore more contagious than the original. Is it?
Yes, that's what the studies are saying. Because of mutation, it is spreading at a very rapid rate.
Actually, mutation is also something connected to the cancer cells. Is it like that?
Yeah, see, mutation can lead to a malignancy when it causes the mutation, when the mutation leads to disruption in the cell membrane and in the nucleus cytoplasmic ratio and all those things, the loss of tumor, the loss of cells to stop growing, and there is an increase in the number of cells at a rapid rate. All those kind of mutations, there are different kinds of mutations. Like there are different kinds of dishes. We don't eat the same thing. Okay, we cook, but we don't cook the same thing every day. It's like that. Mutations are different kinds of mutations. So mutations for malignancy is different from the one which is being going around causing coronavirus.
One person's asking, without social distancing, can we fight the coronavirus?
I don't think so. No.
So now, how long will this period extend to?
That's why people say that it might take around 2 years to achieve that 80% herd immunity which I was talking about. And if that occurs, maybe the social distancing can be done away with.
No, actually, one question, doctor. If suppose we get back to our normalcies in a few days, God willing, so what are the precautionary things that we have to follow apart from these things? Because as an educationist, we work in colleges or schools, or we will go for work. We tend to be in groups, and how can we be careful about the precautionary methods that we need as an institution, as an individual, or as a group? How can we follow these precautionary methods?
See, you follow whatever you are following right now. Okay, don't that is more than enough. Like social distancing, wearing a mask, having a sanitizer, avoiding
So
the
this is going
gathering.
to be a regular routine for us.
That will carry on till that what I said, that 80% herd immunity occurs, or when a vaccine is found. So till then, we have to follow all these preventive measures. It's a must.
So can you give us it is already saying that we are here at a war with corona, a fight against COVID. war front situation. They always make it a battle for us, which again creates a panic to us. So today, I think, Doctor, you've given us a spark in this situation where we can hold on to that and move forward at this time. And there are a few more questions which we would like to take, but just before we finish. So good nutrition can prevent the coronavirus is
Yes.
what I'm just checking whether I've done with all the questions.
Yeah, sure. Please take your time.
Is a positive blood group children more prone to the infection? I
There
think
is-
it's again a myth.
Yeah. There's no correlation between the blood group and the infectivity rate.
Okay. And pregnant ladies, if they are found positive with COVID,
Okay.
what would be the precautions or the treatment that they have to follow?
Just as usual, as any normal person, they need to follow.
Will the child be affected?
Yeah, there are cases when the newborn has been presented with COVID symptoms.
Oh, positive for
Yeah.
the child, newborn.
Yes.
So
yes,
will the newborn also be given the same treatment, or our fingers are crossed with that?
No. The treatment is still the symptoms the same. That is a symptomatic supportive treatment. That is, you treat the symptoms alone. There is no, see, we have, as I said, there's no specific treatment, and you don't. I don't think, and I'm sure there is a. You're not going to give a hydroxychloroquine to a newborn when it is
Newborn,
contraindicated. Yeah, it's
that's what I asked, because
children
the
less than 10
treatment will
years.
be different to a newborn child.
No, the treatment is the same. See, for all corona patients, the treatment is symptomatic supportive treatment. You maintain the fluid level, that is the hydration level in your body. You try to bring down the fever level, the temperature, and give inhalation. All these things are what is called as symptomatic or supportive measures. This is only being followed now.
Okay. So there's another question. When the recovered few patients of China were tested 2 weeks before they showed positive for RT-PCR test, why? Can I come again?
I'm sorry, I didn't get it.
When the recovered few patients of China
Okay.
were tested
Okay.
2 weeks before they showed positive of RT-PCR test, why?
2 weeks?
Before they were tested. I don't know. Before they were showed positive. I think
How did they find out it was positive?
When they recovered, after recovery, that's what we asked, in the beginning itself.
Yes,
in China, the patients are increasing. I think they're talking about the relapse.
Yes, absolutely.
So that's it with the question sessions. Thank you. Thank you very much, Dr. Grace.
Yeah, thank you.
Thank you very much. Yeah. Thank you so much, Dr. Grace, for your valuable time and your patience in answering and clearing our qualms and sharing your knowledge with us.
With you all. Yeah.
Thank you. Thank you, viewers, for joining and making this program more interactive and interesting. Please do fill in the feedback forms and send it across. It would be helpful for us to improvise our forthcoming sessions. Thank you and good night to all.